By 9:30, we will start our class. 9:27. Assalamu alaikum. Welcome everyone. Today's class. Today's topic is very important. Sometimes we used to mistake our disease of the external ear, thinking that something had happened inside. So disease of the external ear is our topic today, and we will go systematically. The external ear, we have already discussed, is composed of the pinna and external ear canal. The tympanic membrane is the part of middle ear. Though the outer surface of the tympanic membrane is skin and have all the diseases of the skin affects the outer surface of the tympanic membrane. The disease of the external ear, if we come to discuss, we will be coming to discuss the congenital diseases and acquired diseases. Some of the diseases are congenital, some are acquired, and some are of no class, and we used to tell them miscellaneous diseases. Congenital will come into congenital diseases, and then the acquired diseases, of which this can be infection, there can be trauma, there can be neoplasm, there can be degenerative diseases. And some are miscellaneous diseases. The classification, they cannot be explained. One or two more diseases have to be remembered. Congenital diseases will come again onto this. The anosia, microtia, narrow absent ear canal. And there are some syndromic diseases like the external ear canal or pinna is absent and associated with some syndromes, like that there are some absent of other organs in the medullary cavity as well as in the mandible, the regions that are affected by the development of bronchial arches, bronchial pauses, the bronchial apparatus. Bronchial arches, bronchial pauses, and bronchial clefts, the three important structures from which the head neck develops. So to discuss these in these headings, anotia means there is no external pinna. The microtia is the pinna is very small and narrow external ear canal, and there are some symptoms. We'll be coming to that. One most important thing in relation to this external ear is earache. And when you discuss earache, I have told in other classes in anatomy as well as in symptoms, earache is very important. Severe painful condition at times causes the patients to come to doctor's clinic in the early hours. Whenever we go to our chamber, in the first 1 or 2 patients we visit usually may be due to severe earache. Most of the patients come to the doctor's chamber early with earache. The earache, we have to keep in mind, this can be local, this can be referred. Local earache is due to diseases of the ear, of which this can be infection, this can be trauma. Trauma, foreign body is also causes trauma. It can be neoplasm of external, middle, or inner ear. But we'll be discussing diseases of the external ear. Local causes and referred causes, pain coming through the nerve due to central irradiation of impulses. You by this time know when there is pain in the gallbladder, the pain is referred to the tip of the shoulder because the phrenic nerve that supplies the shoulder region coming from the same region of the nucleus of which it is supplying the gallbladder region. And pain is called referred whenever a part of the nerve distribution is affected and that is felt in the other regions of the nerve distribution. It happens by the central irradiation of impulses in the level of nucleus. When the impulse go to the nucleus of the nerve, then there is impulse is diffused to the other nerve cells. So the nerve is pain is felt in the whole of the other regions. This is called referred pain. And I will come in detail about how the pain is referred to the ear. So to discuss, whenever you will be asked, what is earache? This is the painful conditions of the ear. Mention some causes of the earache. Immediately you have to mention that the earache can be local, can be referred. And the causes you will start to do. Otitis externa. Otitis externa is the very important and the commonest cause of earache due to external ear diseases. It can be localized otitis externa, and localized otitis externa is mostly due to furunculosis. It can be diffuse otitis externa. Diffuse otitis externa means the whole of the ear canal is involved, and localized otitis externa means the part of in a particular point of the ear canal is involved. We'll come to discuss this. This can be part of generalized skin condition, like a lot of dermatitis. There will be coming. One external ear disease is called malignant otitis externa, or invasive otitis externa, or necrotizing otitis externa. The thing is malignant, will be discussed in detail. It is not a cancer. It is not a tumor. So the word malignant here, meaning that its behavior is like malignant diseases. An external ear disease can kill the patient. Thereby, it is an inflammatory condition of the deep ear canal, but it is named as malignant otitis externa. And keratosis obturence is also a type of otitis externa. Sometimes it can be classified as a degenerative disease. Sometimes it can be a miscellaneous condition. some people classify it in different way, but it is a type of otitis externa also. So we will come to discuss all these diseases slowly. Otitis externa can be localized. We'll be discussing about otitis externa, the painful conditions of the ear due to ear causes, of which due to external ear causes. The localized otitis externa, furunculosis. What is furunculosis? It is a form of localized otitis externa caused by staphylococcus in the hair follicles of the outer ear canal. The ear canal have two parts, outer parts and inner parts. Outer part is cartilaginous, inner part is bony. Outer part have hairs and vibrissae, and sebaceous and sweat glands. We have differentiated these two parts. Inner part is firmly adherent to the bone, highly sensitive, but no hair follicle. So the infection is in the outer part of the ear canal. In furunculosis, we have to remember only few points. It is infection of the hair follicle that affects the outer ear canal. The infection is the staphylococcal infection, and the specific antibiotic for this is flucloxacillin. This is almost always asked. What is the specific antibiotic? This is flucloxacillin. When there is furunculosis, what happens? After cleaning or in diabetic patient, whatever may be the background disease, when there is furunculosis, severely painful condition. If the furuncle become very big, occludes the ear canal, it can be associated with conductive deafness. If there is no, still there is passage to entering of the ear inside, there will be no deafness. Diffuse otitis externa. Diffuse otitis externa, the first we have mentioned, it is idiopathic, meaning that we do not know the cause. Because in fact, these diffuse otitis externa idiopathic groups are due to ear cleaning, and most of the patients do not agree with that. They used to clean the ear, but they do not agree that I clean the ear. Some people sometimes. Traumatic, that is also due to cleaning, and trauma can be due to other causes. We will come to the trauma that causes by foreign body, that causes by ER, that causes by liquids, that causes by solids. We will discuss in detail. Irritant or allergy. We may use something like cotton or any other things, and that causes allergy. And one can be something allergic condition of the skin for any other reason. Bacterial, that is like furuncle. If you clean the ear, there is trauma to the ear canal, skin, and there is some bacteria grows. Fungal, otomycosis. Fungal disease of the ear we call otomycosis. We will be coming to that. Climatic. Climatic means when the ear contains more more water in the in the atmosphere, atmospheric water. That is like India, Bangladesh, especially even Sri Lanka, and all those part of the people that lives near to the seashore. And Bangladesh is a Bodhi in the Magna and Podda. So because of this, the humidity in the air is very high, and thereby the fungal infection is very common in our country. Otitis externa is very common in our country. And the environmental factors, almost same words. The environment, when there is damp environment, the ear affected by this. Part of generalized skin condition, when one has scalp or skin, allergic dermatitis, seborrheic dermatitis, skin is of the scalp is mostly affected by seborrhea. Atopic dermatitis, this is also one sort of allergy, localized allergy. And psoriasis. Psoriasis is a infection of the skin, as well as sometimes it is called an autoimmune disease. So psoriasis is a cause of allergy. If one has psoriasis, he has got skin diseases, and his external ear canal is also get infected. There are some difficult cases like host versus graft reaction. There is also otitis externa is very common. These are very, very rare. but increasing today because of there is a lot of organ transplantation is going on. Malignant otitis externa. I'll discuss you in some detail this malignant or necrotizing otitis externa, the invasive otitis externa, which is so named because it can kiss the patient and thereby it is so named. But it is an inflammatory condition of the external ear canal. You know, sometimes we call Larduy's angina. Larduy's angina is an infection in the floor of the mouth, deep soft tissue infection, bacterial infection, and still with the advent of antibiotic and this today's development, the death rate is almost 50% in Larduy's angina. So an infection in the floor of the mouth is, we nomenclature is angina. And hereby also it is called malignant. There are 5 characteristics of this malignant otitis externa. It is a Pseudomonas infection of the deep ear canal, and the deep ear canal is, the skin is firmly adherent to the bone. So when there is infection, it is in the bone. There is some spelling mistake. The patient must have an age above 55 years of age. Poorly controlled or uncontrolled diabetic. The patient may have uncontrolled diabetic or poorly controlled diabetic, irregularly controlled diabetic or poorly controlled diabetic. This is an extensive spreading cellulitis with osteitis and excessive bone destruction. And disease of one side of the ear can go to the opposite side also through the petrous temporal bone, not through outside, but inside both the petrous temporal bone are very connected through the foramen magnum. So these are important points to remember. Severely painful condition, diabetic patient, more than 55 years, infection is Pseudomonas, and there is extensive cellulitis, as well as there is osteitis causing bone destruction associated with deafness, facial nerve paralysis, and this patient used to die due to immune failure. These patients used to develop immune failure. And when there is immune failure, these patients cannot withstand even a viral infection. Today, coronavirus is affecting all the people. When there is slight comorbidity, these patients are going to die. When this otitis externa patient and his immunity is so low, even influenza infection will cause these patients to death. Keratosis obturence will come what is called steatoma later on. There are formation of furrows of epithelial furrows in the middle ear. Here, the epithelial furrows, the skin furrows are formed in the deep meatus of the ear canal, and this is local destruction of the bone. Tympanic membrane usually remain intact, and thereby patient have very little conductive type of deafness. When the ear is cleaned and properly maintained, the patient do not have any permanent deafness. Trauma to the ear. How ear get traumatized? This is in 3 types of substance. This is ear trauma, solid trauma, and liquid trauma. How ear trauma? Very important, slap. If someone gives slap in the ear, the ear in the closed space of the external ear canal is under pressure. It presses the tympanic membrane and the tympanic membrane ruptures. So this is the most common type of, and you will know when there is rupture of the tympanic membrane, the patient's treatment will be to do nothing. If the patient have upper respiratory infection, give an antibiotic. If there is pain, give an analgesic like paracetamol 2 to 3 times in a day till the pain subsides, and no ear drop, not to allow water into the ear, and not to clean the ear. And the tympanic membrane will be healing in maximum 3 months. In 1 month, more than 80% patients are going to heal. Skin diving. You know, people used to dive from high to low in swimming pools with minimum skin, meaning that they use minimum of clothes. So this sort of diving, boom blast. You know, when there is a bomb blast, there is a very high pressure wave in the atmosphere that directly hits the air canal to the tympanic membrane. And we have seen one thing: if someone is beside a wall and the bomb blast on the right side of the patient's ear, the left side is more affected because the bomb from the down, the energy is coming to the ear obliquely, and this goes to hit the wall, and from the wall it comes horizontally to the ear canal, and usually the opposite ear gets traumatized and tympanic membrane sometimes get ruptured. Thunder, you know, thunder, depending on the direction of the thunder sound, there is sometimes the loss of the tympanic membrane. In solids, the most of the solids you all know: hair clips, massy sticks, welders specially mentioned. Only few people go for welding, but whenever a part of the tympanic membrane is burned by sparks from the welding, then the tympanic membrane will never heal. So it needs repair of the tympanic membrane. In all other forms of traumatic rupture of the tympanic membrane, this usually heals automatically, needs no surgical repair. And foreign body, any sort of foreign body, we will come to discuss what type of foreign body is going to the ear. And the liquid syringing. Syringing is done mostly by the doctors and to remove the wax from the ear canal. This is a very long-term practice. When someone goes for syringing, the water at body temperature using a oral syringe is to be given to the ear canal. It is to be given to the ear canal with a direction towards the roof of the ear canal. And then the water goes and takes the waxes out. If someone gives directly, it goes to hit the tympanic membrane, and thereby the tympanic membrane and ruptures, and there is ear trauma. So ear trauma can be by ears, can be by liquids, can be by solids. Foreign body ear. Usually at times, whenever you go through these things in an examination, teacher used to ask, when an insect enter in your ear, what you will do? If an insect enters into the ear, you have to kill the insect first by applying oily substances or even water, and when it is drowned, it will die. When it dies, it can be taken out by any foreign body for sale. Types of foreign body can be inanimate or animate, living or non-living. Inanimate means non-living, animate means living. The non-living foreign bodies are beds, stones, papers, vegetables, batteries, parts of toys, foams, lead of fences, lot of things, foams, a lot of things we have taken out as foreign bodies from the ear. Even ornaments from the young girls' ear we have taken out. And the animate ones are insects and maggots. Maggots are due to infection. When an infection is not treated properly and immunocompromised patient, then only when the insects, maggots grows from flies. Foreign body ear, you know, ear canal, deep meatus, middle ear. One thing, just this slide, isthmus. When this foreign body go beyond the isthmus, isthmus is the point of junction of cartilaginous and bony part. In the ear canal, this is the narrowest part. And in the ear canal, just beyond the isthmus, the ear canal is deep in the anterior part. So sometimes a examination of the ear can miss a small foreign body if it is in the deep meatus. It can be in the middle ear when there is a perforation of the tympanic membrane, or it is pushed, or it is syringed by someone improperly. Isthmus is a concept you will come to know in long term what is an isthmus. Isthmus is present in lot of places. The communication between the greater cavity and lesser cavity of the peritoneal cavity is by a isthmus. Isthmus is a concept when the two big hills are connected by a small area of small land is called isthmus. Two rivers are connected by a small canals are called isthmus. Isthmus is a concept through which two wide areas are connected by a narrow area. So this is the foreign body of the ear. How it is managed? Forceps removal, syringing, suction, sometimes removal by help of microscope by magnifying this. At times, pedi as a foreign body is very dangerous because pedis have their spikes in the surface, and this whenever someone draws the pedi outwards, it goes inwards. If you pulls it outwards, it goes more inwards. And I have experience, and lot of ENT surgeons have experience of removing this pedi from middle ear and beyond, even from the Eustachian tube by exploring. Exploring means by surgical exploration from the behind. If there is living foreign body, you have to suffocate, you have to drown it, and have to remove it. Removal may need general anesthesia, especially in case of children, and whenever it goes more deep into the middle ear cavity. Otomycosis is another form of fungal infection of the ear canal by fungus. Fungal infection of the ear canal is a very important cause of earache, and there are few people who have not suffered. Most of the people suffered from otomycosis. Oto means ear, mycosis means fungal disease. So fungal disease, Aspergillus nigus, Candida albicans. Nigus means black. Aspergillosis, you know, Aspergillus fumigatus is another organism that affects the respiratory tract. And Aspergillus nigus usually affects the surface, and whenever the fungal mass is removed, it is black. And Candida albicans, albicans means albinos are white. These are two types of fungus that affect the ear canal, Aspergillus nigus and Candida albicans. And their symptoms are itching, earache, discharge of plaques. Treatment, oral toileting, not by the patient, but by the clinician. Oral toileting. One should never clean the ear. One should never clean the ear. Ear is cleaned from itself. I'll show you in next slides. Oral toileting and one antifungal agent, 1% iconazole nitrate local application. This is available in the form of Pevitine, Pevison, Econate. Iconazole is prepared in a lot of ways. It is to be applied 3 times in a day through the ear canal, and not to clean it for 15 days, and to keep it for any time when there is itching, and we have to apply this. There are some people, after a long time cleaning of the ear, they become neurotic to clean the ear. Cleaning cannot be stopped in these people. So these people are advised to keep this medicine. Whenever there is itching, he or she can apply. Advice must be given not to clean the ear, because if you clean the ear, if the patients clean the ear, the disease will come back. If he does not clean the ear, there will be no more fungal infection. So if you are asked about the treatment of otomycosis, if you mention all the points, but do not mention, I have advised the patient not to clean the ear, you are not getting the mark and the treatment will not be completed. Here, I will show you how the normally ear is getting cleaned by itself. Here it is the tympanic membrane. You can see it is the tympanic membrane. It is the tympanic membrane. It is the handle of malleus, a long process of malleus from ambu, and this epithelium migrates here and goes to the margins. This epithelium migrates here, this epithelium migrates here. Because this is very difficult, you have to give concentration how we will explain it. Because here you have to know one basic thing of the skin, why they are going to migrate. The tympanic membrane is very thin, only 4 to 5 layer of epithelium over the this outer skin. The skin of the body, skin of the palm and sole, and skin of the body composed of 5 layers. You know, these are tunica, corneum, tunica, stratum corneum, stratum lucidum, stratum granulosum, stratum basalis. Corneum, lucidum, granulosum, spinosum, and basalis. There are 5 layers of skin. In every layer of skin, there are 4 to 5 layers of cells. There are almost, it takes 1 month to come the cells from the basal layer, the malphizi layer, to come to the surface. And continuously we are shedding, every day, we are shedding 1 layer of epithelium from the stratum corneum. And and this way we are removing and getting fresh skin every day. At the end of 1 month, our skin is getting totally fresh and new. And you may have seen the snakes changes their skin once in a year. And here, this epithelium, this is the point of migration. This is the point of generation. Malphizi layer or stratum basalis behaves like that. The epithelium, as epithelium grows, they migrate towards the periphery. Then they mature, they go to the periphery. And from this periphery to the ear canal, they move outward. Here you see, from the tympanic membrane, from here, they move outwards. From here, they move outwards. From the handle of malleus, they circumferentially they move outwards to the ear canal margin, and then they go outwards. In this outer part, this is cartilaginous part. This is cartilaginous part. It contains hairs. When this epithelium with their secretions come to the outer part, they are entangled here, they are caught here. There is always some dirt in the ear canal. There is with their secretions. And this part of the ear canal is related to the condyle of the mandible. Here, this is the condyle of the mandible. And this condyle of the mandible is related to here. And we are continuously talking, we are sewing, we are just moving our mandible, and every time the ear canal is giving small strokes by the this mandible. And this is the way how the skin is getting naturally cleaned of the external ear canal. And ears need not be cleaned ever. Whoever never cleaned his ear from the beginning of the life, we have seen a lot of people who never cleaned his ear, even in 80 years, even in 90 years, come for different disease. The ear is brighter than everything. Always the ear chok chok korteche kan, kintu kono moila nei. The ear is clear. And those animals or those living organisms who take their food by chewing, their ear is always clean. Their ears need not be clean. Presentations, there can be pain, there can be bleeding, there can be deafness, there can be tinnitus, there is vertigo due to this otomycosis and otitis externa. Diagnosis is straightforward, meaning that whenever you see it, you examine the ear, you find it is localized, it is furuncle, it is diffuse, associated. Clinical examination will give you the diagnosis. Simple. Dermatological diagnosis is dermatological diseases, and habit formation and a patient's habit, this straightforward diagnosis. Now we'll come to the disease of the pinna. Disease of the pinna is there is hematoma auris. One of the diseases, hematoma auris. There is hematoma pervasion in the pinna. Hematoma auris or hemorrhagic fluid accumulates under the perichondrium of pinna following unnoticed or actual trauma or viral disease. There can be actual trauma or there can be unnoticed trauma, meaning that there are some trauma, but we have forgotten about this small trauma which is causing accumulation of this hemorrhagic fluid, or simple viral infection causes where it is accumulating under the perichondrium, in between the cartilage and perichondrium. And this, if not treated properly, it will going to be, this fluid is a sterile fluid. Hemorrhagic fluid, it is sterile. It is not due to any bacterial infection. This is maybe due to viral disease or due to trauma. Diagnosis is very simple. When you see it, there is a swelling which is of very recent origin or 2, 3, 4 days, and this diagnosis is very simple. And treatment, repeated aseptic aspiration with pressure dressing. Repeated aseptic aspiration with pressure dressing. Incision and drainage is always to be avoided, because if you give an incision, there will be infection. This will lead to perichondritis, and the end result of perichondritis will be coming what is it. Wax, normal component of the ear canal. Sometimes you will be getting SAQ wax. Any question related to wax? Wax is the normal component of the ear canal. Seromucinous and sebaceous glands are present in the external ear canal, and these are modified sweat glands. Seromucinous glands are modified sweat gland. There are sebaceous glands. They have protective functions. They lubricate, they entrance foreign material, they contain antibody. When there is a wax, there is sense of blockage, impairment of hearing of conductive type, and sometimes people test water entry into the ear. Water have, yes, normally when water goes inside the ear, it will come out. And if few drops of water remains, the ear canal inside is definitely warmer than the body. When we keep some water in our forehead or in any part of the body, it will evaporate very rapidly. And when the water remains in the deep ear canal, it will evaporate more faster. But when it remains accumulated in the ear, some people say 2 days back, 1 day back, the water entered into the ear canal, meaning that there is some wax or foreign body or something else which have entered this ear. And these patients usually clean their ears. This treatment is syringing or instrumental removal. May need softening before that by application of olive oil or any sort of oils, as well as it can be softened by adding 25%, 10%, 7.5% sudibacab. Injection sudibacab 7.5%, 4 to 5 drops in the ear can be given for 10 days to 15 days. This wax will dissolve and come out. Ears need not be cleaned. Perichondritis is another disease, affects the pinna. Inflammatory condition of the perichondrium of the pinna following trauma or infection of hematogenous by Pseudomonas aeruginosa. Pseudomonas aeruginosa is the infective organism, causes necrosis of the pinna cartilage. Why? Because the perichondrium is lifted. The perichondrium do not have any blood supply. The cartilage do not have any blood supply. Perichondrium is vascular. So Inflammations of the cartilage are very rare, except in radiological inflammation, and this infection here affects the perichondrium. When there is perichondrium is getting infected, there is the cartilage get deprived of its nutrition, and there is necrosis of the penile cartilage. And the necrosis of the pinna cartilage causes, when there is perichondrium, the pinna gets swollen, edematous, and severely painful. Pathology, why this happens? It happens due to ear pricking, surgical procedures, accidental trauma. Who is ear pricking? You know, girls used to have ear pricking in our country, but ear pricking in the level of these lobules, these soft tissues, has no problem. When it touches the cartilage, sometimes you'll see a lot of girls, lots of ladies have pricks other upper parts, and this used to be associated with infection causing this perichondritis, and end result of this is cauliflower ear. Cauliflower surgical debridement is necessary, and cauliflower ear deformity is the rule. All the patients, whoever have a perichondritis of the ear pinna, and his or her pinna will be converted into a cauliflower. It will just shrink to a small cauliflower-like structure. This is a differentiating graph. I will show you also when we will be discussing about acute mastoiditis. When we'll be going to discuss about it. This is due to furunculosis and acute mastoiditis. Here you can have an overview of this. You see what is the difference between furunculosis and what is the difference between mastoiditis. If you do not go through the mastoiditis, you will not understand it properly. But today also I will mention it once, and when we'll be discussing about mastoiditis, we will be again discuss it in detail. Here you see the furunculosis is due to the outer part of the ear canal. Mastoiditis is a disease of middle ear and mastoid system, and there is a history, no preceding history of any ear disease, but there is history of otitis media in mastoiditis. Deafness, no deafness present in furunculosis, but except deafness comes when the furuncle fills the external ear canal and blocks the ear canal. The deafness is always present in mastoiditis. Tympanic membrane. There is no disease in the tympanic membrane. Tympanic membrane seems to be normal, and there is some reflection of the middle ear disease. Pain. When the auricle and the TM joint, when the TM joint is moved, there is pain. When the auricle is moved, there is pain. But in mastoiditis, there is only pain over the pressure over the mastoid. Postauricular groove. In furunculosis, this postauricular groove disappears, becomes shallow. In mastoiditis, postauricular groove remains, and sometimes it is accentuated due to swelling of this. Fistula. A fistula is seen in the outer part of the ear canal. Fistula is seen in the outer part of the ear canal, and in mastoiditis, a fistula is seen in the bony part of the deep part of the ear canal. And X-ray. In X-ray, in furunculosis, nothing, normal. But in otitis, in middle ear disease or in mastoiditis, there will be some haziness of the mastoid ear cell system. Now the point of Reffered autalgia, which is very common, equally common. All the diseases I have discussed with the external ear diseases, and here is only just indication and names of the diseases from which the autalgia is referred by irradiation of central irradiation of impulses. The B2 means the second branch of the trigeminal nerve. Ophthalmic, maxillary, mandibular. The trigeminal nerve has three divisions: ophthalmic, maxillary, and mandibular. This maxillary sinusitis and other sinus infection, this goes to the maxillary division of the trigeminal nerve. This is maxillary division of the trigeminal nerve. This is mandibular division of the trigeminal nerve, through which the molar teeth, all the tooth is supplied by the mandibular division of the trigeminal nerve. So it goes through this. Even temporomandibular joint dysfunction. Sometimes the patient come with earache. You have examined the patient, find nothing. You have not just pressed over, gentle pressed over ear, and you have not feel, and the diagnosis is not done, and the patient goes, but with no improvement. So this comes to B3 means mandibular division of the trigeminal nerve. 7, 9, and 10. Herpes zoster oticus or Ramsay-Hunt syndrome. This is a viral disease that affects particularly these three nerves: glossopharyngeus, vagus, and facial. Facial, vagus, and glossopharyngeal nerve. Herpes zoster oticus causes deafness, causes facial nerve paralysis. There is, because of herpes zoster, there is viral scales formation or viral eruption on the half of the face, along with the facial nerve paralysis. The glossopharyngeal nerve, you know, through glossopharyngeal nerve, there are tonsils, tonsillitis. It can be acute tonsillitis, it can be chronic tonsillitis. Pain is referred to the ear. Tonsillectomy, peritonsillar abscess, ulcer and carcinoma of the tongue, carcinoma of the tonsil, all these diseases are referred through the glossopharyngeal nerve, and the tympanic plexus of the ear, middle ear cavity is formed by the glossopharyngeal nerves. And the vagus nerve, through the vagus nerve, it comes from the larynx and pharynx. Pharynx means hypopharynx, oropharynx, even from the nasopharynx. These regions which are supplied by the vagus nerve, these are supplied from there. Even from the cervical spondylitis and osteoarthritis, the pain is referred to the ear. One patient has cervical osteomyelitis, cervical spondylitis, and osteoarthritis. These patients used to suffer along with earache. Sometimes come for ear concentration, and we have to be sure that these patients have these conditions. So we have to memorize these things. These come from the maxillary division, mandibular division of the trigeminal nerve. It can be facial nerve, glossopharyngeal nerve, vagus nerve, and cervical nerves. And if you remember the distribution of this nerve, it is very easy to remember. You have to tell about this. If you are asked not to mention the nerves, just the diseases, then you can tell the sinusitis, teeth, tongue, tonsil, floor of the mouth, temporomandibular joint. Almost all are related to T, temporomandibular joint, and throat, the larynx and pharynx. All these things are referred to autalgia. And other diseases that affects this neoplasm, of which osteoma and exostosis. These are bony neoplasm, occurs in the deep ear canal. Osteoma means a single bony projection. It is a benign tumor from the external ear canal. Simple removing by drilling is the treatment. Patient may feel itchy or discomfort in the ear. Exostosis is a specific disease of the ear. Exostosis. Exostosis is usually bilateral, affects the both ears. And there are 3 small bony swellings in the deep ear canal near to the tympanic membrane, and 3 specific locations, 3, 7, and 11 o'clock position. If you, it is a rounded thing, we used to express with o'clock positions with the was 7, 11, and 3 o'clock positions. This is believed to be caused only to those people who swimmers exostosis, because this is due to cold water entry into the ear causes maybe causative factor of this exostosis. Squamous cell carcinoma, hydroadenoma, adenoid cystic carcinoma, or unknown reasons, it can affect anyone. If on examination of the ear, we found a polyp, we have to remove it, because when the polyp fills the external ear canal, we have to remove it. If we remove it, then we could see whether it is arising from the external ear canal or middle ear cavity. Polypectomy is the treatment because of blockage, filling, or pain or something. There is an air canal, there is a polyp. Polypectomy is the treatment, followed by examination of the ear under magnification to evaluate the underlying pathology. If there is a cholesteatoma, if there is tympanic membrane perforation, if there is other diseases, we have to find out. So when there is an oral polyp, just oral polypectomy is not the treatment. You have to examine the ear under magnification to find out this. And today, this is the external disease of the external ear. Here we have to memorize, we have to think what are the causes of earache, the causes in the external ear, and causes in the middle ear, causes in the inner ear, and referred otalgia. Today I have discussed in details about the disease of the external ear, of which some are congenital, some are acquired. And among these infections in external ear canal, one disease is very dangerous, malignant otitis externa. The malignant otitis externa is the only disease that is associated with the death. Other diseases are not associated with death. They may cause some pain, some discomfort, some itching, and some conductive deafness, which are curable. The malignant otitis externa, sometimes we have seen students used to write in their papers that what is malignant otitis externa? Sir, it is a malignant condition of the external ear canal. Very dangerous, because it is not a malignant condition. It is not a malignant like that. It is an infection of the external ear canal, which is named malignant because it kills the patient. Thank you very much for today. Next, we will go to the disease of the middle ear, like acute supportive otitis media, chronic supportive otitis media, which have to be diagnosed and dealt by all the physicians. Thank you very much.